After your treatment for your prostate cancer, you'll continue to follow up with your oncologist to follow your PSA levels. However, there may be some symptoms after the intervention, such as erectile dysfunction and urinary incontinence, for which it may be beneficial to see a men's health expert. After undergoing treatment for your prostate cancer, whether it's surgery or radiation, you may have some symptoms of erectile dysfunction or urinary incontinence. As a provider who has undergone advanced training in men's health, I have the ability to offer options for patients who have failed first-line treatments for those conditions. Whether surgery or radiation are selected for treatment of prostate cancer, they both have the chance to impact the erectile function in a patient. The nerves that provide erectile function are very close to the area of operation, as well as within the field of radiation. These can be impacted through the course of the treatment. Both surgery and radiation can lead to urinary symptoms in a patient. Patients may suffer from urinary incontinence, whether they selected to undergo surgery or radiation. Through simple outpatient procedures, we're able to address these issues and restore a significant quality of life for patients. After you've been evaluated, we'll come up with the ideal intervention for you. And depending on the procedure that we select, your recovery time may be anywhere from 1 week to 6 weeks from the procedure. Depending on your symptoms, there are certain things that you could do to expedite your recovery. Your provider may instruct you to perform penile rehabilitation therapy, which is a form of treatment where you take prescribed Viagra, Cialis, or any of those oral medications to restore your erectile function. If your symptoms are more so related to urinary incontinence, physical therapy and pelvic floor therapy may also be useful in order to restore your symptoms. After definitive treatment for prostate cancer, patients may suffer from erectile dysfunction that may improve over time as they get further out from surgery. However, if there is unsatisfactory erections that is inadequate for penetration and satisfactory intercourse with the partner, then oral option, injectable options, and penile prosthesis may be appropriate for the patient. Urinary incontinence may be commonly seen after interventions for prostate cancer. These tend to improve with time, as well as pelvic floor physical therapy. However, if there are persistent symptoms that are bothersome to the patient, then surgical interventions are also possible. Patients are often concerned about loss of penile length and girth after undergoing treatment for prostate cancer. Generally, early and aggressive intervention with penile rehabilitation therapy as well as vacuum therapy may retain some of the length and girth. Ultimately, if there is loss of penile length and girth, then a prosthetic may be needed to restore some of that length. Being diagnosed with prostate cancer can be a life-changing experience for patients. Ultimately, patients should continue to eat well and exercise regularly to maintain a healthy lifestyle. There can be some lingering symptoms from the intervention, and if those do not improve with time and physical therapy, patients should contact their urologist to undergo any further interventions that may be warranted.